Vaginal yeast infection. Email this page to a friend. Email this page to a friend. Facebook, Twitter, Google+. Vaginal yeast infection is an infection of the vagina. It is most commonly due to the fungus Candida albicans. Causes: most women have a vaginal yeast infection at some time. Candida albicans is a common type of fungus. It is often found in small amounts in the vagina, mouth, digestive tract, and on the skin. Most of the time, it does not cause infection or symptoms. Candida and the many other germs that normally live in the vagina keep each other in balance. However, sometimes the number of candida increases, leading to a yeast infection. This can happen if you are taking antibiotics used to treat another infection. Antibiotics change the normal balance between germs in the vagina. You are pregnant. You are obese. You have diabetes. A yeast infection is not spread through sexual contact. However, some men will develop symptoms such as itching and a rash on the penis after having sexual contact with an infected partner. Having many vaginal yeast infections may be a sign of other health problems. Other vaginal infections and discharges can be mistaken for a vaginal yeast infection. Symptoms. Symptoms include abnormal vaginal discharge. Discharge can range from slightly watery, white discharge to thick, white, and chunky, like cottage cheese. Itching and burning of the vagina and labia. Pain with intercourse. Painful urination. Redness and swelling of the skin just outside of the vagina, vulva. Exams and tests. You will have a pelvic exam. It may show swelling and redness of the skin of the vulva, in the vagina, and on the cervix. Dry, white spots on the vaginal wall. Cracks in the skin of the vulva. A small amount of the vaginal discharge is examined using a microscope. This is called a wet mount and cut test. Sometimes, a culture is taken when the infection does not get better with treatment or comes back many times. Your healthcare provider may order other tests to rule out other causes of your symptoms. Treatment. Medicines to treat vaginal yeast infections are available as creams, ointments, vaginal tablets or suppositories and oral tablets. Most can be bought without needing to see your provider. Treating yourself at home is probably okay if your symptoms are mild and you do not have pelvic pain or a fever. This is not your first yeast infection and you have not had many yeast infections in the past. You are not pregnant. You are not worried about other sexually transmitted infections from recent sexual contact. Medicines you can buy yourself to treat a vaginal yeast infection are miconazole, clotrimazole, sheoconazole, taconazole. When using these medicines, read the packages carefully and use them as directed. You will need to take the medicine for 1 to 7 days, depending on which medicine you buy. If you do not get repeated infections, a 1-day medicine might work for you. Do not stop using these medicines early because your symptoms are better. Your doctor can also prescribe a pill that you only take by mouth once. If your symptoms are worse or you get vaginal yeast infections often, you may need medicine for up to 14 days. Clotrimazole vaginal suppository or fluconazole pill every week to prevent new infections. To help prevent and treat vaginal discharge. Keep your genital area clean and dry. Avoid soap and rinse with water only. Sitting in a warm, but not hot, bath may help your symptoms. Avoid douching. Although many women feel cleaner if they douche after their period or intercourse, it may worsen vaginal discharge. Douching removes healthy bacteria lining the vagina that protect against infection. Eat yogurt with live cultures or take Lactobacillus acidophilus tablets when you are on antibiotics. This may help to prevent a yeast infection. Use condoms to avoid catching or spreading other infections. Avoid using feminine hygiene sprays, fragrances, or powders in the genital area. Avoid wearing tight-fitting pants or shorts, which may cause irritation. Wear cotton underwear or cotton crotch pantyhose. Avoid underwear made of silk or nylon, because they can increase sweating in the genital area, which leads to growth of more yeast. Keep your blood sugar level under good control if you have diabetes. Avoid wearing wet bathing suits or exercise clothing for long periods of time. Wash sweaty or wet clothes after each use. Outlook, prognosis. Most of the time, symptoms go away completely with proper treatment. Possible complications. A lot of scratching may cause the skin to crack, making you more likely to get a skin infection. Repeat infections that occur right after treatment, or a yeast infection that does not respond well to treatment, may be an early sign of diabetes or early HIV. When to contact a medical professional? Call your provider if this is the first time that you have had symptoms of a vaginal yeast infection. You are not sure if you have a yeast infection. Your symptoms don't go away after using over-the-counter medicines. Your symptoms get worse. You develop other symptoms. You may have been exposed to an STD. Alternative names: yeast infection, vagina, vaginal candidiasis, monilial vaginitis. Vaginal yeast infection. Most women will get a vaginal yeast infection at some point in their life. Symptoms of vaginal yeast infections include burning, itching, and thick, white discharge. Yeast infections are easy to treat, but it is important to see your doctor or nurse if you think you have an infection. Yeast infection symptoms are similar to other vaginal infections and sexually transmitted infections, STIs. If you have a more serious infection, and not a yeast infection, it can lead to major health problems. Collapse all. What is a vaginal yeast infection? A vaginal yeast infection is an infection of the vagina that causes itching and burning of the vulva, the area around the vagina. Vaginal yeast infections are caused by an overgrowth of the fungus candida. Diagram of the vulvar vaginal yeast infection. Who gets vaginal yeast infections? Women and girls of all ages can get vaginal yeast infections. 3 out of 4 women will have a yeast infection at some point in their life. Almost half of women have 2 or more infections. 1. Vaginal yeast infections are rare before puberty and after menopause. Are some women more at risk for yeast infections? Yes. Your risk for yeast infections is higher if: 2. You are pregnant. You have diabetes and your blood sugar is not under control. You use a type of hormonal birth control that has higher doses of estrogen. You do sure use vaginal sprays. You recently took antibiotics such as amoxicillin or steroid medicines. You have a weakened immune system, such as from HIV. What are the symptoms of vaginal yeast infections? The most common symptom of a vaginal yeast infection is extreme itchiness in and around the vagina. Other signs and symptoms include burning, redness, and swelling of the vagina and the vulva. Pain when urinating. Pain during sex. Soreness. A thick, white vaginal discharge that looks like cottage cheese and does not have a bad smell. You may have only a few of these symptoms. They may be mild or severe. What causes yeast infections? Yeast infections are caused by overgrowth of the microscopic fungus candida. Your vagina may have small amounts of yeast at any given time without causing any symptoms. But when too much yeast grows, you can get an infection. Can I get a yeast infection from having sex? Yes. A yeast infection is not considered an STI, because you can get a yeast infection without having sex. but you can get a yeast infection from your sexual partner. Condoms and dental dams may help prevent getting or passing yeast infections through vaginal, oral, or anal sex. Should I call my doctor or nurse if I think I have a yeast infection? Yes. Seeing your doctor or nurse is the only way to know for sure if you have a yeast infection and not a more serious type of infection. The signs and symptoms of a yeast infection are a lot like symptoms of other more serious infections, such as STIs and bacterial vaginosis, BV. If left untreated, STIs and BV raise your risk of getting other STIs, including HIV, and can lead to problems getting pregnant. BV can also lead to problems during pregnancy, such as premature delivery. How is a yeast infection diagnosed? Your doctor will do a pelvic exam to look for swelling and discharge. Your doctor may also use a cotton swab to take a sample of the discharge from your vagina. A lab technician will look at the sample under a microscope to see whether there is an overgrowth of the fungus candida that causes a yeast infection. How is a yeast infection treated? Yeast infections are usually treated with antifungal medicine. See your doctor or nurse to make sure that you have a vaginal yeast infection and not another type of infection. You can then buy antifungal medicine for yeast infections at a store, without a prescription. Antifungal medicines come in the form of creams, tablets, ointments, or suppositories that you insert into your vagina. You can apply treatment in one dose or daily for up to 7 days, depending on the brand you choose. Your doctor or nurse can also give you a single dose of antifungal medicine taken by mouth, such as fluconazole, fluconazole. If you get more than 4 vaginal yeast infections a year, or if your yeast infection doesn't go away after using over-the-counter treatment, you may need to take regular doses of antifungal medicine for up to 6 months. Is it safe to use over-the-counter medicines for yeast infections? Yes, but always talk with your doctor or nurse before treating yourself for a vaginal yeast infection. This is because you may be trying to treat an infection that is not a yeast infection. Studies show that 2 out of 3 women who buy yeast infection medicine don't really have a yeast infection. 3 Instead, they may have an STI or bacterial vaginosis, BV. STIs and BV require different treatments than yeast infections and, if left untreated, can cause serious health problems. Using treatment when you do not actually have a yeast infection can cause your body to become resistant to the yeast infection medicine. This can make actual yeast infections harder to treat in the future. Some yeast infection medicine may weaken condoms and diaphragms, increasing your chance of getting pregnant or an STI when you have sex. Talk to your doctor or nurse about what is best for you, and always read and follow the directions on the medicine carefully. How do I treat a yeast infection if I'm pregnant? During pregnancy, it's safe to treat a yeast infection with vaginal creams or suppositories that contain miconazole or clotrimazole. Do not take the oral fluconazole tablet to treat a yeast infection during pregnancy. It may cause birth defects. 4. Can I get a yeast infection from breastfeeding? Yes. Yeast infections can happen on your nipples or in your breast, commonly called thrush, from breastfeeding. Yeast thrive on milk and moisture. A yeast infection you get while breastfeeding is different from a vaginal yeast infection. However, it is caused by an overgrowth of the same fungus. Symptoms of thrush during breastfeeding include sore nipples that last more than a few days, especially after several weeks of pain-free breastfeeding. Flaky, shiny, itchy, or cracked nipples. Deep pink and blistered nipples. Achy breast. Shooting pain in the breast during or after feedings. If you have any of these signs or symptoms or think your baby might have thrush in his or her mouth, call your doctor. Learn more about thrush in our breastfeeding section. If I have a yeast infection, does my sexual partner need to be treated? Maybe. Yeast infections are not STIs. But it is possible to pass yeast infections to your partner during vaginal, oral, or anal sex. If your partner is a man, the risk of infection is low. About 15% of men get an itchy rash on the penis if they have unprotected sex with a woman who has a yeast infection. If this happens to your partner, he should see a doctor. Men who haven't been circumcised and men with diabetes are at higher risk. If your partner is a woman, she may be at risk. She should be tested and treated if she has any symptoms. How can I prevent a yeast infection? You can take steps to lower your risk of getting yeast infections. Do not douche. Douching removes some of the normal bacteria in the vagina that protects you from infection. Do not use scented feminine products, including bubble bath, sprays, pads, and tampons. Change tampons, pads, and panty liners often. Do not wear tight underwear, pantyhose, pants, or jeans. These can increase body heat and moisture in your genital area. Wear underwear with a cotton crotch. Cotton underwear helps keep you dry and doesn't hold in warmth and moisture. Change out of wet swimsuits and workout clothes as soon as you can. After using the bathroom, always wipe from front to back. Avoid hot tubs and very hot baths. If you have diabetes, be sure your blood sugar is under control. Does yogurt prevent or treat yeast infections? Maybe. Studies suggest that eating 8 ounces of yogurt with live cultures daily or taking Lactobacillus acidophilus capsules can help prevent infection. 5,6. But, more research still needs to be done to say for sure if yogurt with lactobacillus or other probiotics can prevent or treat vaginal yeast infections. If you think you have a yeast infection, see your doctor or nurse to make sure before taking any over-the-counter medicine. What should I do if I get repeat yeast infections? If you get 4 or more yeast infections in a year, talk to your doctor or nurse. About 5% of women get 4 or more vaginal yeast infections in 1 year. This is called recurrent vulvovaginal candidiasis, RVVC. RVVC is more common in women with diabetes or weak immune systems, such as with HIV, but it can also happen in otherwise healthy women. Doctors most often treat RVVC with antifungal medicine for up to 6 months. Researchers also are studying the effects of a vaccine to help prevent RVVC.